Now let's switch gears and let's talk about the medications used to treat tuberculosis. We're going to talk about 5 different drugs, but we're really going to concentrate on 4 of them because they are the ones that are mainline in treating tuberculosis. So to help us remember those 4 drugs, let's remember the word peri. Peri means surrounding, around. And what happens with TB is that normally our body will surround that germ and encapsulate it. Well, our body's really not doing that. So we have to have these medications on board to surround and kill these bacteria. So that's how I like to remember it. So P, pyrazinamide, which has bactericidal effects, which is a fancy way of just saying it kills the bacteria. Now you need to watch this drug in patients who are diabetic, have kidney problems, or gout, because pyrazinamide increases uric acid levels. And we learned in our gout video, that's the whole reason for a gout attack, is whenever a patient's uric acid levels are increasing. So the doctor is going to be monitoring those uric acid levels. You as the nurse need to be looking for signs and symptoms of a gout attack happening. It usually likes to start in the big toe, the great big toe, and it'll be red and warm. Patient will have limited mobility and it'll be extremely painful. In addition, this drug can cause liver and kidney problems, so be monitoring that as well, looking for jaundice, look at their urinary output. And GI upset is common with this drug, so administering it with food will help decrease that. E for ethambutol, and what this drug does is it stops RNA synthesis. So it's bacteriostatic, which means that it prevents the bacteria from reproducing. Now with this drug, it can inflame the optic nerve. So as the nurse, be thinking about vision and educating your patients to immediately report if they have any vision changes, like their visions become blurred or they have a change in how they perceive color, and they will need regular eye checkups. It can also cause peripheral neuropathy, and this is where you have damage to those peripheral nerves. So be asking your patients, are you feeling any numbness or burning in your extremities? Because this can happen. And if you do have a patient report numbness, burning in their extremities or vision changes, you want to notify the physician immediately about this. R for rifampin, and this drug works to stop RNA polymerase. And what that does is it kills the bacteria. Now there's some things you want to educate your patient on, because there's one thing that they're probably going to notice and it can really make them scared if you don't tell them about it. One thing is that it can turn their body fluids orange, and their tears, their sweat, their urine will be orange, and you'll want to reassure them about that and tell them if they do wear contact lenses, especially those soft kind, it will permanently stain those, so they'll want to switch and wear hard lenses. In addition, educate your patients who are on hormonal like birth control that it will be less effective, so they want to use backup methods, and watch going out in the sun because they can sunburn easily. It makes the skin more sensitive. And absolutely no alcohol while taking this medication. Really, with all these drugs for tuberculosis, your patients want to avoid alcohol because the liver can be affected with almost all these drugs. So no alcohol, and teach them about signs and symptoms of liver issues like jaundice, they're having issues bleeding. I for isoniazid, also INH. And what this drug does is it kills bacteria and stops its growth. But one thing that this drug can also do is decrease vitamin B6 levels. So a lot of patients who take this are going to be on supplements, and you'll want to assess your patients for that peripheral neuropathy that can happen during low vitamin B6 levels. Like ask them, are you having tingling in your extremities? Do you feel excessively tired, depression, which can all point to that vitamin B6 is low. And again, monitor liver function and for neurotoxicity. And lastly, streptomycin. Now this drug isn't as commonly used as those other 4 I went over because of its side effects, but it is used in some patients, and I want you to remember the big thing with that. One thing is that it stops protein synthesis and it kills bacteria, but a big side effect of this that you want to watch out for is their hearing. So you want to monitor their hearing and ask the patients, Are you having any issues with hearing? For instance, are you having ringing in the ears? Because this drug is ototoxic and it affects cranial nerve 8. So always ask your patients who are taking streptomycin if they are having any hearing issues.